Another key factor is understanding and applying prioritization strategies. And this is what most of you guys know already. This is the most common known prioritization strategy. You know that priority is established in this order: airway, breathing, circulation. You know that airway goes before breathing and breathing goes before circulation. That is a known fact, I would say, in most nursing students. However, you might not know this other part of the prioritization guidelines. We have pain, education, and feelings. You might not know this. For the NCLEX, pain is considered psychosocial in nature. So if you don't know this, if you didn't know this, comment on the chat. I didn't know that. I didn't know pain was considered psychosocial in nature for the NCLEX, but it is. Why? The patient is not going to die because of pain. But how come, Professor? What if a patient has chest pain from a myocardial infarction? The problem there is not the pain. The problem there is circulatory. Because in an MI, a myocardial infarction, there are occlusion of the coronary arteries or the coronary artery. So the problem there is circulatory. That is why it has the priority, not because of the pain. And a lot of times I see nursing students prioritizing pain. I am not saying that pain is never the priority. There could be scenarios where pain is the priority. But you have to learn how to identify when pain is the priority. So physiological needs has the priority over psychosocial needs. ABC is priority over pain, education, and feeling. Now, let's look at some examples and let's see how we can implement prioritization strategies. We can think critically to answer those style of questions. A young adult is admitted to the emergency department. So we have a little bit description here about the patient. Young adult. What else do we have? It is admitted into the emergency department after an automobile accident, and after an automobile accident, the client is anxious and complains of severe pain in the right chest from contact with the steering wheel. We have a lot of good information here. The patient is complaining of pain. So the problem that we have on the stem of the question is pain. And how is the style of pain or the type of pain? Severe. So we have mild, moderate, severe. So this is a very important scenario. We're dealing with an emergency here. It says the nurse observes shallow respiration. Why is this important? The stem of the question is telling you that the nurse is doing or did an assessment. So we have a scenario where the nurse observes for shallow respiration. So this means we have a respiratory problem. So what is the priority for me as the nurse in a respiratory problem? You see, now you have a clear picture of what is happening. So we know that we're dealing with an emergency. We know that the nurse did an assessment. We know that the patient is in severe pain. and we have a respiratory problem. How do we know that this is a priority question? Keyword first. Reduce the client's anxiety. Important. Why is it important? The patient is anxious. Good answer. Maintain adequate oxygenation. Important answer. Why? The patient has respiratory problem, shallow respirations. Answer number 3, administer pain medication to decrease the chest pain. Important, because why? The patient is in severe pain. And number 4, maintain adequate circulating volume. Oh, okay. This one does not make a whole lot of sense to this scenario. There's no indication of bleeding. There's no hypotension with tachycardia like we saw in the post-percutaneous liver biopsy scenario. So maintaining adequate circulating volume, in my opinion, does not make much sense in this scenario. So I think we can eliminate it. So what is the first action here? To reduce the anxiety level? To maintain adequate oxygenation? Or to administer pain? When the 3 problems are accurate to the scenario. If you don't use a prioritization strategy, then you won't be able to know what's the correct answer. Reduce anxiety is psychosocial. Oxygenation is physiological. And you learned today that pain is psychosocial. So if we use Maslow's hierarchy of needs and we think about physiological needs takes or has the priority over psychosocial needs, then we can eliminate answer number 1 and we can eliminate answer number 3. So the correct answer is answer number 2. Why is this the correct answer? For priority reasons, airway breathing has priority. But also, does it make sense to the stem of the question? Of course it makes sense. The patient has shallow respiration. You know that this patient can have many complications, including ABG's complications. So it says, the client diagnosed with pericarditis is complaining of increased pain. Which intervention should the nurse implement first? Wow, great scenario. We know it's a priority scenario because we see first. It does not give you a lot of information about the patient. It just says the client. That's it, nothing else. So in this scenario, it's not important. Keynote, in case you didn't know, if it doesn't specify the patient is an adult. Okay? Always, it's an adult. Unless it says pediatric patient or an elderly adult. So we're dealing with an adult that was diagnosed with pericarditis. So this is the medical diagnosis. And this is what the patient is complaining of increased pain. The word increase means change in condition. That's what it means. So you have to say, okay, so the patient now has increased pain. What is that telling me? Well, I think you got to ask other questions. Like, for example, what is the level of pain? What did it increase to and from? Because, for example, if I tell you that the patient had a pain level of 2 and now has a pain level of 3, did it increase? Yes, it increased, but That's not a big problem. But if it increased from 1 to 9, well, it went from a mild type of pain to severe pain. So in this scenario, we don't have a whole lot of information about the pain. So the data that we have is subjective in nature. Is it an emergency? I don't know. Because chest pain in pericarditis is expected. Now, what type of pain? What is the severity of the pain? So in this scenario, we're probably looking to do an assessment and validate the information that we have on the stem of the question. Administer oxygen. This is an implementation. Evaluate, assessment phase. Urinary output. That's important. Assess the client for cardiac complication. Assessment. Validation. And encourage the client to use the incentive spirometer. Teaching. This is an implementation. Well, we already talked about an assessment has not been completed in this scenario because all we have is something referred from the patient. And I cannot tell if this is an emergency or not. So I'm going to go with an assessment. So I can eliminate answer number 1. Wait, professor, you eliminated an answer that says oxygen? Yes. Why? There is no clinical indication that the patient is in any type of respiratory distress. So there's no need to provide oxygen on this patient. And this is a very common misconception with nursing students. Every time they see oxygen, they want to click on oxygen. Every time they see assessment, they want to click on assessment. No, it depends. It depends on the scenario. So answer number 1, we can eliminate. Why? There's no clinical manifestation of a respiratory problem. Assessment for urinary output, thinking more on circulation as well. Assessment for cardiac complications. Multiple complications. This is a good assessment. And number 4, encouraging to use the incentive spirometer. Can this help the patient? Yes, in the future, but it's not my priority action at this moment. So we can eliminate answer number 4. And in between 2 and 3, which of the 2 answers go directly to the problem? Pericarditis is a cardiac problem. So I need to do an assessment and look for cardiac complications to identify if this pain, if it's secondary to pericarditis or if there is another type of complication going on that is causing the pain. So answer number 3 is the correct answer. Says the client with increased intracranial pressure is receiving mannitol. Oh, we have a very interesting question now. We have pharmacology now involved. Because the stem of the question is telling us that the patient is receiving a medication. So we don't have a lot of information about the patient. We have a problem of increased intracranial pressure. And the patient is receiving medication. Which intervention should the nurse implement to evaluate the effectiveness of the medication? So now what we're trying to do is an evaluation to identify keyword if the medication is effective. Why is this keyword important? I'm not looking for a side effect of the medication. I'm not looking for an adverse effect of the medication. I am looking for an answer that tells me the patient is better. This medication is helping the patient with a neurological problem. So I have to look for an answer that tells me something neurological. So by telling this, I think it's very clear on what the possible answer could be. So let's review the answers. Answer number 1, monitor the client's vital sign. Important. Vital sign covers a lot of information. So I like answer number 1. Maintain a strict intake and output. Intake and output is going to be more pertaining to, I guess, dehydration or hydration status. But does it tell me if the medication is effective in a neurological problem? No. So I think answer number 2 we can eliminate. Now, look at answer number 3. Assess the client neurological status. Is the patient alert, oriented? Is the patient lethargic, confused? So answer number 3 is an assessment as well. Well, professor, what do I do now? I have 2 assessments, and both of them are important. Vital signs, that's very important. Why not vital signs? Why select neurological status, which is the right answer, over vital signs? Very simple. Whenever you see an answer that tells you to do vital signs, that is generalized, but you see another answer that is specific to the problem, that validate the specific problem, you need to select that answer that validates the specific problem. In this scenario, answer number 3 is more specific than vital signs, that is more generalized. And answer number 4, to check the osmolality levels, well, this is important because we are administering mannitol, but does not evaluate the patient neurologically speaking. So we can eliminate answer number 4. The correct answer is 3.